And the last thing we need to talk about is to give an introduction to joints. So we are getting ready to move into Unit 2 after this lecture, where we will begin to look at the bones of our body and the muscles that attach to it. So this is a good lecture to have before we get into Unit 2, where I give just a nice introduction to joints. So joints are also called articulations. This is where two bones come together. All right, so articulations. An articulation, or a joint, is the place where a bone meets another bone. It can also be where a bone meets cartilage or also teeth, which I'll go on to show you. Articulations vary in their stability and their mobility. So some are more stable than others, while others are more mobile. So you're going to have a lot of movement in some joints compared to others. And they're actually classified into categories based on these two qualities. So we are going to look at joint structure. I'm going to show you what the joints are how they are constructed. But as a general rule, the more mobility you have, the less stable the joint is going to be. So like in your shoulder, that joint is very movable. We have a lot of range of motion with our shoulder joint. But that actually is the least stable joint of our body. It's really prone to injury. And so you're going to see vice versa, the same being true. So when a joint is less able to be moved, it is going to be more stable. So here's a nice picture showing you that inverse correlation. Before we even get into the different types of categories of joints, it's important to note that the more mobile a joint is, the less stable it is. And then vice versa in the contrast side of things, if you have an immobile joint, that is what is most stable. And then we have a lot of joints in between. But there's this inverse correlation between how much movement we can have. So in our shoulder and in our hip, they are going to be the least stable types of joints. And then we have other types of joints, which I'll go on to give you more specifics, but the bones that make up the skull, and then the intervertebral joints, so the area between each of the vertebrae forms a joint, and those are somewhat, definitely immobile with the skull. We have slight movement with our intervertebral joints, but again, there's that inverse correlation between having a lot of movement and being less stable versus having no movement and being a lot more stable. So joints can be classified in two categories. So we can classify joints based on their structure, okay? And there are different types of structures that you're going to see within joints that I will go over. So we'll talk about fibrous joints, cartilaginous joints, and synovial joints. And then they can also be classified by their function, their ability to move. All right, so let's start here first, and then we'll talk about classification by function. So we have structure, function, categories. So a fibrous joint, and I have pictures that I'll show you on the next slide, which will show you examples of each of these types of joints. A fibrous joint, this is when bones are held together by dense, regular connective tissue. Cartilaginous joints, just as the name implies, bones are going to be joined together by cartilage. And then finally, we have synovial joints. These are actually the most complex joints. You're going to see these type of joints in the most movable joints that we have in our body. And these are bones that are separated by a fluid-filled cavity. So there's going to be a synovial membrane, there's going to be synovial fluid, and again, I'll show you all that in a moment. And then secondly, we can classify joints by their function. So we are going to use anatomical terms to classify joints. So these terms that I need you to learn are, first, there's something called synarthrosis. Synarthrosis joints. These are joints that have no mobility at all. They are completely immobile. The next type is amphiarthrosis. Amphiarthrosis, these type of joints have some mobility, a little bit of mobility. So they are slightly mobile. And then the last classification is called diarthrosis. This is a freely movable joint, and I'm going to give you examples of each of these. So let's start by going down this list right here of the structure of joints and what that means in more detail. This would also be another time to get out and draw a flow chart of joints so that you can keep all of these terms in order and that you can kind of follow and flow through a diagram so you can see how the categories are formed and what joints are in each of those categories. So we're looking at fibrous joints. These are, again, bones that are joined by dense, regular connective tissue, and there are 3 different types of fibrous joints. The first is called gomphosis. All right, and again, I keep saying this, but I do have pictures on the next coming slides so that you can see exactly what these look like. Gomphosis joints are between the teeth and the maxilla and the mandible. This is our upper and lower jawbone. Okay, so the joint between the teeth and the upper jaw and the lower jaw. These are examples of gomphosis joints. And these are synarthrotic. They are completely immovable. The next type of fibrous joints are sutures. You can find sutures in the skull. These are joints between the skull bones. So there are several skull bones that make up the skull, and they are fused together by sutures. All right, and this is another example of synarthrosis because these joints do not move. The last type of joint in the fibrous joint category are called syndesmosis. These are joints between parallel bones, and you have 2 sets of parallel bones in your body, in the forearm and in the leg. So this is the radius and the ulna, and the tibia and the fibula, okay? And there is a joint between these 2 bones that is holding these 2 bones together and stabilizing them. This type of joint is amphiarthrosis. So there is some slight movement in that joint. So let's take a look at what this looks like on a picture because I think it'll make more sense when you see it on a picture. So we talked about 3 types of joints, 3 types of fibrous joints. So the first one was gomphosis. This was between the tooth and the mandible and the maxilla, okay? So you can see that the joint here is what's holding the tooth in place so that it is nice and stable. So that is a gomphosis joint. It is a fibrous joint. The second one are sutures. So you will see suture lines between the flat bones of the skull. That is another example of a fibrous joint. There is dense, regular connective tissue there. And then finally, we talked about syndesmosis. This is the joint that is in between the ulna and the radius. That is what this white material here is showing you. This is a fibrous joint between these two bones that helps stabilize these two bones. There is some movement because you can move your forearm, you can supinate it and pronate it. We haven't talked about movements, but once we do, that will make more sense. You can move these two bones, so you have some movement here. You have no movement here. And no movement here. All right, so these are 3 examples of fibrous joints. The next group of joints was cartilaginous joints. These are when bones are attached by cartilage, and there are 2 specific types of cartilaginous joints. The first one is called synchondrosis. That is when bones are joined by hyaline cartilage, and they are also synarthrotic. They are not able to move. And then the second type is symphysis. These are bones that are joined by a pad of fibrocartilage. Let me show you examples of both of those. All right, so here are the examples of synchondrosis. This is when there is cartilage present. So there is hyaline cartilage. So remember when we were talking about bone, we talked about the epiphyseal plate. That was the growth plate. That is where the epiphysis and the diaphysis join together. So that is an example of a synchondrosis joint. The second place that you could find this type of cartilaginous joint is that the ribs attach to the sternum is right here, by hyaline cartilage. That's what this is right here. So this is another example of synchondrosis, of that type of joint, cartilaginous joints. So where the bone, is meeting another bone, so the rib here is meeting with the sternum here through an area of cartilage. And then the second type of cartilaginous joints were symphysis. I'm not drawing. Doesn't want to draw below that line for some reason. There we go. And this is a situation where you're going to have fibrocartilage. So if you remember, so up here is hyaline cartilage, and down here is fibrocartilage. So they're both cartilaginous joints. They're just using different types of cartilage to form the joint. So the intervertebral discs, that is what cushions the vertebrae. It helps keep stabilize the vertebrae. That is an example of a symphysis cartilaginous joint. And then there is a piece of fibrocartilage between the pelvic bones, the 2 hip bones, and that is called the pubic symphysis. That is another example of the cartilaginous joints, more specifically, symphysis. So I think it would be a good idea to make a flow chart and examples of the different types of joints that you can find in the body, what they are composed of, and then the types of joints within each of those. So we gave several examples of cartilaginous joints. We gave several examples of fibrous joints. And the last one I'm going to talk about are synovial joints. And these are the most complex joints. There's a lot of structures that make up a synovial joint. And again, synovial joints are found with the most movable types of joints. So they are freely movable. They are diarthrotic joints. These are found with articulating bones that are separated by a joint cavity. So our knees and our shoulder, you can find synovial joints. So the general makeup, what makes up a synovial joint, I have listed here. And then on the following slide, I have a couple pictures of what synovial joints look like and how they are organized. So we are going to talk about the articular capsule, the joint cavity, the synovial fluid that surrounds the joint. There's going to be articular cartilage. Remember, at the ends of every bone, especially the long bones, there is hyaline cartilage there. There's going to be ligaments that stabilize this synovial joint. And there's also going to be nerves and an abundant blood supply that enters the synovial joint. So let's talk about the actual structure of a typical synovial joint. And when you go on to study synovial joints, try to draw them so that you know the components. Draw them and label them so you know where the components are and how the synovial joint is structured. So as we were saying, I was telling you when we talked about long bones, we talked about the hyaline cartilage that's on the edge of the articulating surface of the bone. So this is what's called the articular cartilage. All right, that's a really smooth surface that's going to allow those two bones to come together and have that free movement that this synovial joint is going to provide. Within this cavity, so there's a joint cavity here, it's kind of outlined in purple. That is the joint cavity, and that is what is going to contain synovial fluid. And that is going to help buffer that cavity and keep it moist and keep a nice liquid surface on it. The synovial fluid is coming from the blood vessels that surround the synovial joint. It's actually made up of plasma that comes from blood. So outside of the joint cavity is the synovial membrane. Okay, that's what you can see in light purple here, the synovial membrane. And then outside of the synovial membrane, there is going to be a fibrous layer that adds another additional layer of support, which is what you see here. This is going to encapsulate the synovial joint and provide stability around it. So it's also important to realize that synovial joints are richly supplied with sensory nerves and also has a rich blood supply. So sensory nerves are going to be present to be able to detect pain. So if you injure that joint, there are nerves there to detect that pain. And these nerves will also be able to monitor how much that capsule is being stretched, to know how much pressure is being put on that joint. There is a rich blood supply, so the synovial membrane also has a layer of blood vessels associated with it, capillary beds. And this is the basis. These are the cell types within that membrane that are going to be producing that synovial fluid. So this is another nice picture showing pretty much what I already talked about. You can see the articular cartilage on each side of the bone. You can see the synovial membrane in green. That is what is going to be producing the synovial fluid, which is inside this cavity. The synovial membrane, along with that fibrous capsule, is what is making up the articular capsule, right? That's what's going to provide some stability around that joint. And then the last thing is there's going to be a ligament that is also going to surround that synovial joint, because again, this is a very movable joint and we want to have as much stability and protection around that joint to protect it from injury. And the last topic I really want to touch on is what makes a joint stable? What is providing a joint with stability? And so we kind of talked a little bit, but not a whole lot, about the shape and sizes of joints, but there are differences in terms of how bones come together. And it turns out that the surfaces of joints, whether it's a ball and socket joint, any of the different types of joints that we have, that this type of arrangement of a joint really rarely plays a role in stability. So sometimes you think that the way two bones fit together, that might provide some stability, but in fact that has little to do with the stability of the joint. Now, ligaments that surround the joint do help a little bit, and they do create a stronger joint. However, the most important feature to joint stability is having muscle tone. That is actually what creates the most stable type of joint. So the most important factor in joint stability is your muscle tone, the muscle around your joint. So the more you work your muscles, the more stable your joints are going to be. And this is what's going to keep tension on the muscle tendons. So muscle tone is the number one factor that will help with joint stability. And lastly, we'll just talk about a couple clinically relevant disorders that can happen with joints. The first one is called osteoarthritis. This is actually the most common type of arthritis, and this is when you have degeneration of cartilage in your joints. This is also like wear and tear arthritis. So if you are using your body a lot, and with age, sometimes you get a degeneration of the cartilage in the joint. This can be very painful, and this is like the wear and tear arthritis. That is what is osteoarthritis. Rheumatoid arthritis is a little bit different. This is actually an inflammatory disorder. So you have a lot of inflammatory cells in the area that is causing a lot of pain. And this is pretty prevalent in women. And there's really no cure for rheumatoid arthritis. The best you might be able to do is take anti-inflammatories, or steroids is another option. And then the last type of arthritis is called gouty arthritis. This is when you can get a uric acid buildup from the blood supply, or the capillaries that are leading to the joints, and this causes a lot of pain in the joints, and this is most prevalent in men. So if you produce too much uric acid in your blood, so this can happen in your kidneys. If your kidneys aren't filtering blood correctly, you can get uric acid buildup. And this causes sharp crystals to form in and around the joints. It can happen in the feet. It's actually very, very painful for this to happen. Usually the most you can do is take anti-inflammatory medications, or you can also change your diet or exercise, decrease alcohol intake. So it tends to be short-lived if you're able to make adjustments to your lifestyle. All right, I think that's an X-ray of rheumatoid arthritis. You can see the inflammation that is happening in the digits. It is actually pretty painful too. I think this is going to wrap up this lecture. on muscle and joints, and this will conclude the lectures for Unit 1.